Hello, and welcome to my presentation regarding vulnerable populations of adults with chronic illness. So, three learning objectives for this presentation. So, the first one is audiences will be able to identify the different types of discrimination among adults with chronic illness. Two, audience will be able to understand and describe someone in the chronic illness community. And three, audience will be able to discuss the social justice issues that occur within the chronic illness community. So, to introduce, according to the CDC, chronic illness is defined broadly as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living or both. So, some examples of chronic illness include Parkinson's disease, rheumatoid arthritis, hypertension, lung disease, um, POTS syndrome, Ehlers-Danlos syndrome, gastroparesis, and a lot of other chronic conditions that we've learned about so far while in school. According to the CDC, 6 in 10 adults in the U.S. suffer from a chronic illness. Also, 4 in 10 adults in the U.S. suffer from a chronic condition, more than one. So, 2 or more chronic conditions. 4 in 10 Americans suffer from that. And when it comes to chronic illness risk factors, there's a lot of things that play into that, such as where you live, your current environment, your working environment, genetics. All of those things play a major role in some chronic illnesses that you could suffer from later in life. So, how is chronic illness marginalized in society? So, chronic illness in a working environment, um, when talking about it being reflected in the work environments, um, sustainable employment is much less likely for those with chronic conditions compared with those without. For patients, having chronic illnesses is also associated with an increased perceived chance of being discriminated against in the workplace. As a result, workers with a chronic illness on average felt more psychological strain and decreased ability to complete their work. However, participation in work life is an extremely important social aspect for the well being of those with chronic conditions, health conditions, so being able to engage this way may influence the person's condition negatively. So, as that was a passage from one of the articles that I had found that is cited below. It is really, really important that people with chronic illnesses aren't involved in the workplace. According to 2015 EU labor force survey, the rate of employment is approximately 30% less for people with restrictive health conditions when compared to people without these conditions. Um, so you're less likely to see people nowadays who have chronic conditions or chronic illnesses because of their illnesses, not because they don't want to or not able, it's because of their illness. Chronic illness in schools and sports, so kind of going towards like adulthood schooling, so colleges, later in life, high school. We're more likely to judge somebody based on what they look like. And a lot of chronic conditions you can see, but there are some that you cannot see. So, we're more likely to judge somebody that is different than ourselves. Some people with chronic illnesses are unable to play sports, or they're not given the opportunity because they are physically different. Chronic illness in the community, like I mentioned before, 6 out of 10 is more than 50%. That is a lot of people. We pass a lot of people throughout our day, and there is a really strong possibility that that person has some sort of chronic illness, whether that be type 1 diabetes, or if they had a stroke, or if they have early onset Alzheimer's or heart disease. Um, so, unfortunately, like I said before, we are more likely to judge a person based on what they look like rather than what they can do. And chronic illness in the home, if you are the only person who has a chronic condition or is suffering from a chronic condition, it's going to be really difficult to kind of feel included and not feel like you're left out because of your chronic condition. How is chronic illness marginalized in healthcare? So how are people with chronic illness treated in healthcare? Um, they are treated differently. A lot of healthcare problems, especially when you go to the emergency room, and that results in the next point, which is if you're going to the ER. The ER is seen to be for acute problems rather than chronic conditions or so forth. So, working as an aide, we see a lot of exacerbation of COPD, or acute kidney injury, or hypertensive crisis, or diabetic ketoacidosis. Those are exacerbations of a chronic condition. We're often more likely to judge, like, why couldn't they control their diabetes better, or why weren't they taking their blood pressure medication. We do these little markers of judging a person rather than really looking in depth to it. So on the side here, chronic disease are expected to increase to 57% by 2020, and that is true, and that goes into chronic illnesses, the chronic illness epidemic, to the healthcare crisis. That is a very big thing that is happening currently. So a small passage from an article that I had found says that currently some 50% of the U.S. population has a chronic disease, creating an epidemic, and 86% of healthcare costs are attributable to chronic conditions. So it is just continuously on the rise, and the price is continuously rising also, due to this epidemic in chronic illnesses, and it's going to continue to rise, especially after COVID, with patients such as COVID long haulers or exacerbation of already chronic illnesses because of COVID, and new ways to manage chronic illnesses. A lot of people are, finding new medications, finding new treatments, but unfortunately, sometimes that works, sometimes it doesn't, so it's a lot of trial and error. Social justice issues for the chronic illness population. So social justice refers to the allocation of benefits and burdens to the members of society. So outstanding medical bills, that's a huge one, especially for people with chronic conditions. When you're dealing with a condition, you're less likely eventually to have coverage for that condition. So your medications, testing, and whatnot. So the ongoing medical bills, and that's going to increase in costs, and then you're going to be in millions of dollars of debt. Lack of educational resources for specific chronic illnesses, that's a huge one. New illnesses and new diagnoses are coming out every day, and there aren't educational resources for all of them, so it is really hard to feel included and feel like you're being heard when you have a lack of resources. And then lack of fair equity in the opportunity. And we'll go a little bit more further in depth with that on the next slide. So health equity and the access to healthcare for people with chronic illness. So health equity when it comes to discrimination in the healthcare place. So such as like illnesses that are more prevalent in certain communities and so forth. Genetics plays a big role in that. Sometimes we cannot control it, such as type 1 diabetics, or if Alzheimer's runs in the family, or if you have the breast cancer gene. Living environments, such if you live in a big city, or if you live in the suburbs, or if you are living in a house that has increased CO2 or whatnot. And then working conditions, if it's high pollution, high heat, chemical exposure, those are huge things that can greatly increase your chances of having a chronic illness. And then access to healthcare, so lack of specialty resources. A lot of chronic conditions are treated with specialists, so it can be really hard to find a specialist, especially when you may not have the money or insurance coverage. And then lack of doctor's appointments. A lot of these conditions are not well known and or needing research constantly, and there's not a lot of doctors available to help with that. So unfortunately, you may be waiting a year or two to see a specialist. As mentioned before, lack of insurance coverage. So that is going to be a huge problem, causing millions and millions and millions and millions of dollars in debt for Americans and just America in general. Medical gaslighting is a really big thing, especially for people with chronic conditions. Just the, oh, you're fine, when really you're not fine and you need help. And then the unknown diagnoses because of the new illnesses coming out daily and people not being educated enough to treat these new conditions. So how can we decrease disparities? So number one, so educating the community on chronic conditions. So just educating them and helping them to understand how important it is that we work together to really help America and just the world in general when it comes to chronic conditions. Providing resources for people that better manage their diseases. So I think education is key, especially for people with conditions. Providing more education to help prevent those crises would really help bring the cost down, but also help with self-management and having people feel more independent. And I think that would be a really big thing. And lastly, so bringing the community together, so helping clean up low-funded areas that maybe have high pollution or high drug rate or not clean drinking water, to really bring together and really bring into perspective some of the ways that people are living and how we can make that better. And then here's some local sources. So the first one is group services is life care management for adult chronic illnesses, helps find nursing care, resources for people with chronic conditions. The second one is multipleconditions.org. If you go on and there's lists and lists and lists of different chronic conditions, you can go on, learn, find resources for each chronic condition, and this was really cool to be able to find all the different types. And lastly is a Zoom meeting in regards to chronic pain, chronic illness. It's a support group. We meet second, fourth Wednesdays of every month for about an hour and a half, and it's completely free. And it is a really great way to express your feelings and be able to relate to people that are dealing with something very similar to you. Here are my references. Thank you for listening.